Welcome to Peers Across the Pond. I'm Kasper in the United States, a peer advocate and a Japanese preschool teacher.
I'm Karen Machin from the UK with a real interest around peer support and research.
Technology, right?
And technology and this and that.
I would say we are multi-curiosity. How's that? Because peer support fits with curiosity. Just always what's going on.
Yeah, that's a big word for us over here, saying about curiosity. It's about curiosity about the person. Yeah. How are you, Anne? Tell me what's been going on for you this week.
We could talk about what's going on in the United States as far as peer support is going on. There is SAMHSA, which is I hope I get this right, Substance Abuse and Mental Health I forgot the S's, Administration. And they are holding a big, and you read about it in the Peer Researchers Network, a big research meeting and going to come up with ideas about research.
Yeah, no, I'm really curious to find out more and like who's involved, because to me, I kind of read little bits of it and I was just like, that could be anywhere. And it wasn't very pushy or ambitious, or there was no bit that stood out and I thought, wow, that's something new we can learn from. It was all very, yeah. So I'm curious. Tell me more about it. What's going on over there?
I really don't know. So here's what's going on. The Office of Recovery at the SAMHSA administration, which was created last year, apparently chose certain people to be at the meeting. And I believe
it was 30 or 40, I think it said, yeah.
Right, online. And they're coming up with things about research. The SAMHSA administration of the Office of Recovery chose about 30 to 40 people, as you were saying, to meet for the week, make ideas, or I don't know if it's standards or about peer research.
And do you know what's going to happen with that?
No clue. And we just got some news 2 days ago, right? In that listserv of ours. We'll just have to see. I don't even know how people are chosen. It's very interesting. I know in our peer field from our values are about transparency and about community and about working together. So it's interesting.
I was going to say that. Is it because America's so big that, because I hear kind of everybody knows each other. I mean, there are lots of people we don't know, and we do have to make special efforts to make sure we're really including people who aren't on the list, whose names don't fit. You know, we make special efforts around that because we have to. But at the end of the day, it's quite a small place. Compared to you over there, that must be really difficult to try and find the people who haven't been included. So what special efforts do you make that we could perhaps learn from? Because you must be really good at it over there.
I know when I was invited personally to the first meeting to talk about making this Office of Recovery, that I held personally 6 online meetings with hundreds of people across the United States, hundreds of peers, and some others joined in to get ideas what to bring to the meeting. So they knew about the meeting, they knew when it was, and in fact, it's time for a follow-up meeting with those people who become the Office of Recovery, with the hundreds of people that I brought together. But that was just me as a volunteer without getting paid doing that. And so you were saying that you have to include people. What do you mean you have to include people in England in these processes? How is the process different for picking people?
I guess because a lot of the funding over here, you've got to show that you're including people. You know, it's got to have involvement. For research, for example, you've got to have involvement. When it comes to mental health, we know that particular groups of people suffer disproportionately or are excluded from services or only reach services when they're in crisis. So we know that there are certain groups of people that really need to be included, to hear their voices where they might be traditionally excluded. So having known all that, we then have to go and find those people. And whether that's us as lived experience researchers keeping on saying you've not included X, Y, and Z, or whether it's people from the top saying we need to go and find these groups of people, where do we find them? There is that push to make sure that people do include people. And I think as lived experience researchers and peer workers, we're always alert to who's missing, because we know we've experienced it ourselves in some way. So we're always alert to thinking, well, yeah, okay, we've got a group of people in the room, but who's missing? Whose voices aren't heard? For us, it's around, urban and rural areas, for example. But the contrast for that over here is nothing compared to for yourselves, is it? In terms of, we complain about having to travel for 2 hours, but that's, I know from what you've said that is nothing for you. But it's things like that, isn't it, that make a big difference. Access to digital, for example. How do you make sure that you include people who can't access digital services, because there are pockets of the UK where it's really difficult, aside from whether people can afford it or whether they're living in houses of multiple occupation where they might be sharing internet connections with people. So how do we reach these people who are traditionally excluded? So we're always making that effort because we have to. Don't you do that there?
We do. And I think SAMHSA is trying to do that. And my question is, who's representing immigrants, refugees, and asylees? The people coming from that work, and I haven't gotten an answer yet. The materials I looked that person sent out that were produced at the meeting had nothing to do with their experiences and researching their experiences, things like that. I think there's a genuine interest and effort to reaching out. And you have to think about, even if you reach out, what are they walking into? Is it going to work for them? Like, we find a lot in peer support. Yes, you can reach out and hire a peer supporter, but what system are they walking into? And is it going to work? Especially government meetings here on mental health. In Oregon, on making regulations about, let's say, who decides the fate of a person, if they're competent or not competent to go to trial, which means they end up staying in jail or the state hospital, which is a psychiatric system. I find myself being the only peer at most of these discussions because other peers, and even one of the other peers I brought in, don't feel comfortable in holding up the truths that where we come from and being the only person or one of the only two people in those rooms. So when you're bringing people in, think about, what are you bringing them into? Can you speak to that, please? In England, do you do better than we do?
I don't think so, because I think the spaces tend to be controlled by people in traditional power. So whether that's health service, legal service, policymakers, traditionally, certainly in the UK, those tend to be of a certain kind of people, a certain class, a certain educational background, certain privileges, and it's their system. So that excludes so many of us, quite often based in London as well. So London, although everyone's heard of it, it's very different to the rest of the country. I guess like Washington or New York might feel very different to, like you say yourselves, on the West Coast. I don't know. You say it so naturally, and I'm like, west, east, left, right.
Well, we just had different reference points. We're right, different place. And we were going to talk a little bit too. I'm going to skip over just about language and peer support and how it works and training. And you were bringing up to me today, you were asking me, do I speak English? And I think and what was your statement about that? Go ahead, Karen.
I can't remember what my statement was, but I was just curious as to whether, because I know you're American, and I know I'm English, and I know I speak English, and I know you speak slightly different to me, so we can understand each other. Although occasionally there'll be a word or a phrase that we kind of have to explain to each other. So I was wondering, I really just wanted to know whether you describe your language as American or English. I was confused. And you said,
coming from actually linguistics and linguistics background and working on that master's in linguistics, I speak Oregon, North American English of the Portland dialect and accent. So to go to that part, we have to be so careful in the United States that we don't just say we're American, because we're actually North American. There's all kinds of Americas here, right? There's Latin America, there's South America, there's Canada, more northern than we are. And I have been instructed over the years, just be really careful. So I speak North American English with a West Coast accent. And we actually think on the West Coast we don't have an accent, right? Because the TV, the media speaks like we do. So if somebody from the South or the Northeast of the United States, and even the Midwest, you won't see so much. I mean, it's different now, but in the past, you wouldn't see their way of speaking across the larger media. Is that, do you have a special English? Because I don't speak apparently English. Do you have a special English that's used in media that's more accepted than others? Because you have so many accents and I guess also dialects in England.
I mean, traditionally, 1950s BBC was all very much about the Queen's English, wasn't it? And that pronunciation of the language was always the way. But I think nowadays in the media, people are quite accepting of more regional accents. I think they feel it's a bit more down to earth. It reaches people. People like it, but there are stereotypes of certain accents that aren't like. So I think the usual one people pick out is a Birmingham accent. Don't ask me to give impressions of accents because I can't do it. But people usually pick out a Birmingham accent as not sounding very good. They don't like that. Whereas people quite like an accent from Newcastle or Liverpool are quite often seen as good accents. So, whereas if you've travelled around the country like I have, I've lived in lots of different places, so you lose the accent. I'm hopeless. I can't do it anymore.
Would that affect peer support if you have people from different accents? I have met people from England who told me that they learned a certain accent to get to a certain income level or a certain kind of work that they weren't accepted before if they spoke the way they did at home naturally. How does that work in peer support?
I think peer supporters have to work with lots of different people, so you have to be understood because it's about communication, isn't it? It's about relationship building. So you have to build that relationship of trust. You have to be understood, and you have to communicate in a way that other people will understand you. So I think it's fine as long as people can understand you. I dropped my original accent because no one could understand a word I was saying. Long ago.
How old were you when you dropped it?
Probably when I moved away to college, so I'd got a very broad local accent. And then at college, people were from around the country, and they were like, "What? Didn't understand it." And yeah. So and it's a long time ago, but that has happened. I don't think it's as much the case now. There's a lot. I mean, I'm old. You know, the internet's been invented. The media is very different. So people are hearing different accents, you know, internationally as well as regionally in the UK. So we're hearing more, aren't we?
But that's fascinating to think about being authentically who you are, and you actually change the way you speak, which in linguistic terms and other terms changes who you are, how you see the world, how you.
And did you never have to do that over there in America then? Would no one do that? Because that's quite normal over here. You do code switch to whoever you're with.
Well, code switching, yes. I would say accent switching, no. I mean, I don't know because my North American Portland, Oregon accent is generally accepted. So I personally don't know. If I came from the South and worked in the North, it might be something different. I like hearing different things. And even, let's say in New York City, you'll have different areas. It's so interesting in a small area. You have different areas, completely different ways of speaking. And then when I hear someone speaking from different areas or Long Island or New Jersey or something, I can actually guess where they're from. Now in Oregon, kind of more general, I can't guess someone from Northern or Southern Oregon from the way they speak. I can't tell the difference. There's no difference as far as I know. So that's something different. And even from California to Seattle to Idaho to Montana, generally, I can't tell where they're from that. But if you go into the Midwest, North Dakota, you start going further east, you hear different vowels. And I'll ask, because I'm linguist studies, I'll ask, where are you from your vowels? They sound a little different. I get curious when I'm allowed to ask. Texas definitely has its own way of speaking. I think there's variations within Texas itself. So it could be that a peer supporter in the North could, we should do a study on this. It'd be fun to find out, is peer support better or worse or no difference? Is, say, if you have a Southerner doing a peer support verbally and listening with a Northerner, or vice versa, or New York or Oregon, we're just really, really different.
Yeah, I wonder what difference it makes. That's a good idea for a research project.
Yeah, we don't have we do have some vocabulary differences, but not a lot. Like, say, on the East Coast, they'll say tennis shoes. No, we say tennis shoes, they say sneakers. There's a few things that pop up once in a while, but basically can understand most things, or we've gotten used to it through media and TV and YouTube now, what other people are saying.
And written down, if they were on an online forum, for example, on online peer support, written down, it would all be the same, I guess, apart from those odd words like sneaker and what was the opposite, training shoes.
It's so interesting because new texting, new things, I don't know if it's the same or not. It may be, I would say, generational. I would say doing peer support, written peer support, which is actually a lot of mental health peer support is done by texting now. Our national lines, hotlines, things, warm lines, well, not so much warm lines, but more hotlines, have texting options. Do you have texting options over there for mental health, like, say, crisis support?
I think there were at one point. I've not looked recently because there was and then there wasn't. So I don't know where we are with that at the moment. Some got withdrawn, but then there were some where there was a bit of a concern around where the data for that was all going to. A lot of concern around where the data was going to, because it was a crisis service. So yeah, I don't know where we are with this at the moment.
So it's good to know I don't speak English. Thank you, Karen. And I think let's go on to talking about the SAMHSA, National Model Standards for Peer Support Certification. They've come out with them. Again, that was another group of people they got together. I believe they actually had an application process in that one, and people could apply. They first only put the applications out to people they thought should apply. SAMHSA's Office of Recovery had a very narrow scope of who they thought should be there. And then we peer supporters and people in the mental health civil rights movement just kind of talk to each other and say, hey, did you hear about this? Here's the link to apply for this national standards committee that they're getting together. And so a lot more people did apply after that. And SAMHSA said, oh, we're opening it up for others to apply. So now we have made national model standards, and there are pages and pages and pages of these standards that they've come up with, which are fascinating. The National Association of Peer Supporters, which is a nonprofit in the United States made to support people who are doing peer support. And the man who started it, Steve Harrington, was really, it was many years ago. I remember meeting him at an alternative conference, which is our peer conference, national conferences. And I believe it was 2004, 2005. I met him at one of those conferences that was in Portland, and he was starting up this organization. And it became international, and they've gone back to national now. It's a small nonprofit, very few employees. A lot of them work, as I understand, online with each other. So I don't know if there even is a physical office. It's a membership, so you can join as a member. I think the rates are reasonable. And they have a national conference every year about peer support. And people come in, and I spoke last year on digital peer support and civil rights, digital civil rights. Other people speak on other things, crisis support, anything to do with peer support. And I like the definition that Steve Harrington gives. It's on the top of their website. The National Association of Peer Supporters says, simply put, peer support occurs when people in a particular circumstance reach out to help each other in the same or very similar circumstance. It is the act of a person or persons reaching out to others to help them deal with the life challenges. So that's what Steve Harrington said. I think sometimes it's not a reaching out, it's just being there. So just to go into 2 points, the National Association of Peer Supporters wrote a response to those national standards for peer support certification. So what they say is that in general, the whole document, they say family and youth peer support need to be separated from each other. They are not integrated certification in any state and have unique and nuanced differences between them. And they also recommend the inclusion of standards for specialties such as veterans who have lived experiences in prison and jail systems and more. It was interesting, a small committee on the National Association of Peer Supporters came out. Again, I could put the link to their recommendations as well for that response. I don't think SAMHSA changed anything because they had a response to it. Out now, and President Biden and his administration support these standards. There's just so many standards, and they call them the SAMHSA's core competencies for peer workers and behavioral health services. And they describe peer support, I'll read their definition here: offering and receiving help based on shared understanding, respect, and mutual empowerment between people in similar situations. In their document, they say, for the purpose of this document, the terms peer supporter, peer worker, and peer specialist are interchangeably used to describe a person with lived/living health experience, lived/living experience, either directly through a current/former dependent involving a problematic mental health or substance use condition, and who supports other people experiencing similar challenges in a wide range of non-clinical activities, including, and this is good, advocacy, navigation and linkage to resources, sharing of experience, social support, community and relationship building, group facilitation, skill building, mentoring, goal setting, and more. Across the United States, various other terms such as recovery coach, mentor, peer provider, or peer navigator are used to describe peer workers. So in this context of the document, both the terms peer and peer worker are used to interchangeably describe someone working in a mental health, substance use, and our family support role, both certified and non-certified, unless noted in their document. So what do you have to say for that?
Yeah, all right.
What does that mean in your English? Yeah, right. I don't know what that means, Karen.
I mean, I think, it's fine, isn't it? I agree with that. It's a good broad range of activities there. I like it that they've got advocacy in there. That list is useful. And then the language, I know that you'll probably pick up on the language, but those ideas of coach and mentor and supporter and navigator and provider. I mean, we have similar challenges around that over here. I think because the role of a peer supporter isn't yet defined. I would argue that maybe it doesn't need to be defined, because I think I like the flexibility of people being able to do lots of different things, but maybe they do need all those different job titles. And therefore, should it be called, I don't know, a lived experience workforce, for example, as opposed to peer support, because they're all lots of different roles? What do you think, Anne?
I think even we've been talking about the role of what lived experience is lately. Even the term lived experience is used in so many industries right now. It doesn't necessarily go back to mental health and substance use or misuse or whatever the terms are that people choose to use. I think we should come up with a new term for ourselves, because peer support, lived experience is used so widely now. People don't think about mental health and substances and and other addictions.
Yeah, I think when we're in a field, we shorten it, don't we? So when we say lived experience, we're actually referring to lived experience or living experience of mental health services, mental health challenges, substance abuse services and challenges. You know, we're talking about so many different things that we could be referring to, but we always shorten it just to lived experience, don't we? I was listening to somebody talking about journalism the other day and saying, should journalists have lived experience, or does that bias them if they've got lived experience of the topic or the region that they're working in? So yeah, lived experience is out there as a phrase that's seems to be using a lot at the moment.
Yes.
And we need to be more specific. I can't think of an alternative term. You're the linguist. Can you think of one?
Not this morning.
Put you on the spot.
No, you're Karen, you're later in the day over there. So I think that's something we should come up together as a community and communities and work on that. What works for us? And I think without having more specific terms, more of our work will be diluted. And also thinking about similar experiences and situations as Steve Harrington was talking about, and as the standards go to. I like to say, like, for people Karen, do you think so? For example, if someone has never had a psychiatric inpatient experience, and they're working as a peer supporter in an inpatient hospital, how does that work? To say lived systems experience, because it helps to know what the systems are like. And we have a lot of people getting hired now because they want to help people, which is good, and they have some mental health background, but they've never been in the systems themselves, or forced in, or been in. And I think without that system experience, the peer support sometimes is not as good, and sometimes harmful to those who are in the systems, because they just don't come from that background. Can you speak to that?
Yeah, absolutely. I think you're right. I think if someone's being employed as a peer supporter to work within a specific element of a service, then they should have some relatively recent, it doesn't have to be in the last X number of years, because we know that people might not be ready to work and go back into a system that they've used straight away. So they might want, it might take them a little while, or they might prefer it to be really new. I'm not arguing about that one, but I think something about using that specific service. And then I think that becomes a challenge for peer supporters, because if they're employed to be a peer supporter in a specific service because they've used that specific service, so for example, perinatal services. Okay. So then how do they progress if they want to go higher up the career ladder within a service? They're then limited to that one service, and I think that I can see that being a problem for peer supporters, and I see them worried about that. We've had some services over here where it's been a pilot project, and we know that the pilot is getting closed down. And for other people who work in that service, who might be nurses or social workers, they can go and get a job in a completely different service because their skills are transferable. Whereas as a peer supporter, employed because of their experience of that service, where do they go? They end up without a job. So I think that is one of the challenges that we do need to think around.
Well, that's a great point, and maybe we should ensure that everyone has access and to somebody who has that lived system experience. Maybe there could be teams, and maybe some people who don't have that direct experience can be good, but on their own they can cause harm because they don't know enough. What I would say, maybe a suggestion to deal with that is to have teams and make sure that at least the people working in teams or in pairs, at least one person has that same systems lived experience. So there can be a check-in of what works or doesn't work. And it's also very interesting to think about how recent or not recent, and how do you keep updated on that. That's a discussion here as well.
There's that, but then I think also if there's many peer support workers working in different services within an organisation, and they've got a network there where they can all start to learn from each other, then their lived experience starts to be transferred into building lived expertise, because they're hearing lots of different experiences, and it starts to be a different level and a different understanding, which I think that perspective is really useful. So it's developed just from their own personal experience of a specific service to thinking wider, thinking more strategically, understanding that actually there's a lot in common. It's not all about difference. Sometimes it's about the similarities, even though we feel quite different. How do we make those connections? I think then it starts to get really exciting, but that does require numbers. So a lot of peer supporters around, which you have over there, but we're not at the same scale over here.
We're still all learning to work together, especially in the substance use or misuse and gambling and mental health. I think we're still all learning to work together. We see it where one part or another is trying to overpower the other. As we're doing that, trying to find who we are in definition, it's not good for the whole. So as long as we can start to work together, appreciate our differences, and do the work that's going to work for that person directly, and that person chooses what's going to work for them, and have those options available. That's the important part, I think. We are actually running out of time, Karen. I know. Not oops, it's good. Supporting each other through curiosity, through authentic listening. What other things can we use to, Karen, from the peer world?
No, I like that curiosity. Let's stick with that curiosity and the listening. I think that is so important, isn't it, to move things forward at a slow pace. We don't have to rush into these things. Let's just take it slowly and be curious about each other. I like it.
Yes, let's be and stay curious about each other. Well, thank you for joining us, and we'll see you on the other side.
Thank you.